Hi, everyone. I'm Rachel Fox, and I'm a PhD candidate at the University of California, San Diego. This presentation, Constructing Weight Stigma Without Fat Politics, Entrenching Anti-Fatness in Stigma Interventions with Health Professionals, is based on one chapter of my dissertation, which examines how weight stigma became part of anti-obesity efforts. Before I dive in, I wanted to give a brief content warning. A lot of what I'm talking about is pretty upsetting, and I'm going to be using the words obese and obesity when I describe other fields of research. If that's hard for you, or if you don't want to see images of thin people in fat suits, I encourage you to prioritize your own safety and comfort and step away. Okay, so the background for this project is that healthcare is a major site of oppression and harm for fat people. For example, in the DiagnosisFat Twitter hashtag started by fat activist Leslie Kinzel in 2014, you can find hundreds of stories of fat people who have sought out care and were told their problems resulted from their weight and that those problems would resolve with weight loss. Here you can see tweets describing doctors dismissing a PCOS diagnosis, recommending weight loss for an acute knee injury, ignoring pelvic pain that turned out to be a tumor, and prescribing weight loss medications rather than antidepressants without a patient's knowledge. As a result of encounters like these, fat activists have for decades attempted to get health professionals and public health to recognize the problem of medical anti-fatness. On this slide is a plea from Ellen Maud Bennett's obituary, where her loved ones wrote, "A final message Ellen wanted to share was about the fat shaming she endured from the medical profession. Over the past few years of feeling unwell, she sought out medical intervention and no one offered any support or suggestions beyond weight loss. Ellen's dying wish was that women of size make her death matter by advocating strongly for their health and not accepting that fat is the only relevant health issue." In more recent years, some academics with little or no relation to fat activism or fat politics have also identified medical discrimination against fat people as a problem, rebranding it as weight stigma, such that it A, fits within social psychological paradigms, and B, so that its consequences can be redefined within medical terms. On the right, you can see a description of weight stigma from a 2022 article authored by researchers employed by Weight Watchers that says, "Weight stigma increases the risk of high allostatic load, psychiatric and substance use disorders, and suicidality. Rather than motivating healthy behaviors, weight stigma contributes to avoidance of healthcare, healthcare inequities, increased weight gain, and eating disorders. Thus, preventing weight stigma should be prioritized in healthcare settings." In other words, according to this paradigm, weight stigma is a problem because it can interfere with weight loss and or cause weight gain, not because it harms fat people, or not just because it harms fat people. Weight stigma research is thus an example of what Charlotte Cooper, Kat Pause, and others have discussed as knowledge making about fat people without fat people. In her article, Ray of Light, Standpoint Theory, Fat Studies, and a New Fat Ethics, Kat Pause explains, fat people are often denied the agency to know their own truths. As noted by Charlotte Cooper, expertise around fat is not to be found from fat people, and the problem of fatness is both proposed and solved by thin people. In science, in media, and culture, fat people are rarely allowed to speak on the topic of fatness. We are not allowed to be the knowers of our own bodies and experiences. Even when fat voices are included, the ones heard the loudest are non-fat. And that's really frustrating because fat activists and fat study scholars have been shouting about the problem of medical anti-fatness for a really long time. But not only that, we've actually proposed solutions for it for a pretty long time. We have identified medical fat oppression as emerging from a structural problem, the weight-centered health paradigm, which trains health professionals to demand weight loss rather than treating whatever health problem a fat person is seeing them for. And we've suggested a structural solution, the weight-inclusive health paradigm, which says to do the opposite, treat health, not weight. And specifically, the weight-inclusive health paradigm argues that health professionals should not engage in weight loss counseling at all, and that weight loss counseling directly contributes to medical anti-fatness. In contrast, weight stigma researchers have decided that weight stigma is a problem of individual attitudes and beliefs. They argue that health professionals don't understand the etiological complexity of obesity, i.e., that weight is determined by genetics, the environment, that it's not individually controllable. And that misunderstanding is why health professionals treat fat people so badly. And their proposed solution is to provide educational materials about, for example, the partial genetic basis of weight, as well as the aforementioned consequences of weight stigma, i.e., that it causes weight gain and healthcare avoidance. The problem with this approach to weight stigma is that it leaves intact the fundamentally stigmatizing premise that fat people are diseased and need to be cured, even if weight is not individually controllable in this paradigm. As fat activist Marilyn Wann phrases it, there is no nice, unstigmatizing way to wish that fat people did not eat or exist. Reducing weight stigma has to start with valuing fat people and not trying to get rid of us. In contrast, weight stigma researchers believe that since fat people face medical oppression, the best way to solve that oppression is to get rid of fat people. This headline from the New York Times about a new weight loss drug called Wegovy reads, "New drugs could help treat obesity. Could they end the stigma too?" So here I'm going to give away the punchline of this presentation. This approach to weight stigma is diametrically opposed to the weight-inclusive health paradigm that fat activists have identified as the way to get fat people better healthcare. In this approach to weight stigma, getting fat people to lose weight becomes an even higher priority for health professionals. Now I'm going to take you on a deep dive into one way health professionals are being taught to enact this oppressive idea. The one branch of weight stigma research is made up of interventions, meaning there are people trying to figure out how to reduce weight stigma, especially in health professionals. This is a review from 2016 that identified 17 interventions, none of which worked to reduce stigma. However, many more have happened since as the interest in weight stigma grows. I've been scouring the literature to keep track of them and what they're doing for the health professionals who participate in them. One flavor of intervention that's gaining popularity right now is based on the social psychological idea of empathy, that if health professionals can put themselves in an obese person's shoes and understand their perspective, they will provide less biased care. Heads up for a fat suit. So one way some researchers are doing this is by putting health professionals in fat suits, which have been conveniently renamed in the weight stigma literature to bariatric empathy suits or obesity simulation suits. So far, I've identified 3 interventions in which health professionals were put into fat suits in order to try to make them more empathetic towards fat people. There's this study from New Zealand with 7 nurses, another from the UK with 29 nurses, and one from Canada with 42 family medicine residents, all published in 2018 or later. And the citations for those are going to be at the end of this PowerPoint. So I've been working with the quantitative and qualitative results from these studies, not to see if the interventions reduce weight stigma as the researchers intended, but to see what being in a fat suit is actually teaching health professionals who participate in these interventions about themselves, about fat people, and about what they owe to their fat patients. Spoiler alert, it is not good. One major thing that happens in these interventions is that health professionals essentially use all their preconceived negative ideas about fat people to interpret their experiences in the fat suits, leading them to assume that their discomfort in the suit is reflective of fat people's experiences. They assume that the way they feel is comparable to how fat people must feel, which erases the ways that fat bodies adapt to weight gain over time, in addition to just being patronizing. For example, they assume that since they have trouble moving in the suit, that all fat people must struggle to move or that we're out of shape. One quote from one study said, "Going through the different activities made me extremely breathless and insecure at every point of the way, where I was unable to see my own feet and not knowing where I am stepping. I was extremely scared to even step into the bathtub, let alone gathering courage to go out to a swimming pool to get some exercise. And a participant from a different study, to do my shoelaces, it was hard for me to just bend forward. I couldn't move properly to even see my feet. So again, in these quotes, it's clear that health professionals are assuming their negative experiences are reflective of fat people's lives and bodies. And this is setting them up to see themselves as the heroes who are responsible for rescuing fat people from our plight. Another interesting thing that happens is that in the fat suits, the health professionals begin to experience the consequences of fat phobia. But instead of recognizing that fat phobia is what's affecting them, they attribute those negative experiences to being fat. So one participant said, if I was in my home, I probably wouldn't want to leave it, which recognizes that fat people are surveilled in public. Another participant said, you sort of felt very observed by people who were staff members in the hospital. Some patients or visitors were quite conspicuous in their observation as well, but not as much. There were a couple staff members who I really felt were observing me. It did feel like I was being judged a couple of times. Now, to be clear, this surveillance could have been because of how ridiculous this person looked in a fat suit, but that's not what they're attributing their experience to. They think it's because of the weight. So even though these health professionals are experiencing fat phobia, it doesn't lead them to the conclusion that they should combat fat phobia. Instead, it reinforces for them that the best thing they can do for fat people is help us become thin. The quantitative results of these studies back up this qualitative data. The time in these suits intensifies health professionals' commitments to engaging in weight loss counseling with their fat patients. In this table, if you look at the far right column, you can see family medicine residents became more comfortable, which is a lower score, in assessing a patient's potential root causes of weight gain, advising patients on available treatment options for obesity, and assisting patients in addressing their barrier to proper weight management, among other things. And not for nothing, this study received funding from Novo Nordisk, who is the maker of the weight loss drug Wegovy. In this table, again, if you look in the far right column, you can see an increase in agreement. So nurses agreed more with the idea that obese adult patients would prefer to be put on a weight management program while in hospital. And they also really increased their agreement with a bunch of negative ideas about fat people, including that obese adults are self-conscious, not self-confident, depressed, do not feel socially accepted, experience unresolved anger, experience fatigue, are the subjects of ridicule, and feel guilty. And you might notice this plus 40 over here, which is a huge increase in the agreement that obese adults are depressed. And if you're curious about how these results get presented in the research article itself, the authors of this article say, overall, this study suggests that following a structured simulated educational experience, student nurses' attitudes were more positive towards obese patients. So literally, these researchers think that nurses more deeply believing that fat people's lives are terrible is a positive change in attitudes and an increased amount of empathy. So what does this mean for us? Well, first, by excluding fat voices and fat politics from the field of weight stigma research, stigma researchers have defined weight stigma in a way that intensifies medical anti-fatness. I didn't discuss it much in this presentation, but a lot of research and advocacy work in this field is funded directly by weight loss or anti-obesity organizations, including Novo Nordisk and Weight Watchers International. Second, the interventions stigma researchers are performing with health professionals are making those health professionals more likely to take the exact actions that fat activists have identified as harming fat people. And third, it's impossible to reduce weight stigma while also trying to eliminate fat people. And it is, frankly, a little scary that researchers are using apparent concern for fat oppression to actually intensify it. Fat activists used to have to worry about the consequences of anti-obesity work, and now we have to worry about that and weight stigma work. So thank you so much for listening. If you want to connect with me, here is my contact information, and I really hope to hear from some of you. Here are the fat suit studies, and here are the rest of my citations.